Effective non-surgical solutions for gum disease and bad breath. Periodontitis, a severe form of gum disease, and persistent bad breath, halitosis, are two common and often interconnected oral health issues. While surgical options such as osseous surgery are available for advanced cases, many non-surgical treatments offer comparable results, without the discomfort, downtime, or risks associated with traditional surgery. For patients with mild to moderate gum disease, and even some with more advanced conditions, these non-invasive approaches can be highly effective at reversing disease progression and resolving chronic bad breath. This article outlines the most effective non-surgical strategies and how they can form the foundation of a long-term oral health plan. Understanding the link, periodontitis and bad breath. Periodontitis is a chronic inflammatory disease caused by bacteria that accumulate in plaque and tartar. As the infection progresses, it can lead to gum recession, bone loss, and eventually, tooth loss. The very same bacteria responsible for this infection also release foul-smelling volatile sulfur compounds, making periodontitis a primary cause of chronic bad breath. Therefore, treating periodontitis is often the most effective way to resolve halitosis. Why choose a non-invasive approach? For many patients, non-invasive treatments offer a compelling alternative to traditional surgery. The primary benefits include less pain and discomfort. Procedures are less traumatic to the gum tissue, with most patients reporting minimal discomfort. Faster recovery. Since there is no cutting or sutures, patients can often return to their normal routines within a day or two, unlike the weeks of recovery often needed for traditional surgery. Preservation of healthy tissue. These methods are designed to be highly selective, helping to preserve more of your natural gum line and preventing the significant gum recession that is a common side effect of traditional surgery. Comparable efficacy. For a large number of patients with moderate to severe gum disease, non-invasive methods achieve results that are as effective as traditional surgical procedures. Your path to a healthier mouth. A typical non-invasive treatment plan for periodontitis follows a clear, two-phase process. Phase 1. In-office treatment. The initial goal is to eliminate the existing bacterial infection and deep tartar buildup. Scaling and root planing, SRP. This is considered the first line of defense against gum disease and is the gold standard for non-surgical gum disease treatment. It is a deep cleaning procedure that has two distinct parts. Scaling. A dental professional uses specialized instruments to meticulously remove plaque and tartar deposits from the tooth surfaces, including the critical areas below the gum line. Root planing. After scaling, the rough surfaces of the tooth roots are smoothed to remove any remaining bacteria and to make it more difficult for new bacteria to accumulate. This also helps the gums to heal and reattach to the teeth, reducing the depth of the periodontal pockets. Laser therapy, a minimally invasive alternative to surgery. This advanced approach is often used in conjunction with SRP to achieve superior results, especially in reducing pocket depth. A dental laser's energy targets and removes only the diseased gum tissue and bacterial biofilm, leaving healthy tissue untouched. This method is highly effective because it promotes tissue reattachment and regeneration. The laser's energy stimulates the body's natural healing response, encouraging the formation of a fibrin clot that helps the gums to reattach to the tooth surface and, in some cases, promoting the regeneration of lost bone. 1. It provides powerful bacterial reduction. The laser's heat sterilizes the periodontal pockets, killing harmful bacteria that traditional cleaning alone may not fully eliminate. Antibiotic therapy. To combat the bacterial infection, antibiotics may be used as a supplementary treatment. They can be administered in several ways. Topical gels or chips. A dentist can place antibiotic gels or small, medicated chips directly into the gum pockets to release medication over time, targeting the infection locally. Oral medications. For more severe infections, a dentist may prescribe oral antibiotics in pill or capsule form. Antimicrobial mouthwashes, prescription-strength mouthwashes, such as those containing chlorhexidine gluconate, e.g., Peridex, PerioGuard, are often recommended to reduce bacteria and control plaque formation. Phase 2, long-term maintenance, crucial for success. After the in-office treatment, consistent at-home care is essential to prevent the disease from recurring. Without a diligent routine and regular professional checkups, the disease is likely to return. Professional care, regular dental visits for maintenance cleanings are non-negotiable. At-home care, this involves a diligent routine using specialized tools and products to control daily bacterial buildup. Clarification: how non-surgical methods reduce pocket depth. It's common to wonder how non-surgical treatments can reduce the depth of gum pockets, especially without the cutting involved in traditional surgery. The difference lies in the fundamental mechanism. SRP reduces pockets by healing, scaling and root planing. SRP works by physically removing the irritants, plaque and tartar, that cause inflammation. As the inflammation subsides, the swollen gum tissue naturally shrinks and tightens, and the gums reattach to the now clean root surface. This biological response is what leads to a reduction in pocket depth. Laser therapy enhances this healing. The laser's role is not to cut the pocket to a shallower depth. Instead, its tiny fiber tip can reach into deep, difficult to access pockets where scaling instruments cannot. The laser effectively kills bacteria and removes diseased tissue in these areas, creating an ideal, sterile environment. This deep sterilization, combined with the laser's ability to stimulate healing and tissue reattachment, significantly enhances the results of SRP and often leads to a more complete and lasting pocket depth reduction. This synergistic approach, removing the accessible deposits with SRP and then using the laser to clean and sterilize the inaccessible areas, allows for effective treatment of moderate to severe cases without resorting to surgical incisions. When non-invasive therapy may not be enough. While highly effective for most patients, non-invasive therapies have their limitations. There are specific cases where a traditional surgical approach may be necessary to achieve a successful outcome. Severe bone loss. In advanced cases where significant bone loss has occurred, surgery may be required to access and reshape the bone, creating a healthier environment that non-invasive methods cannot reach. Extremely deep pockets. For periodontal pockets that are very deep, typically exceeding 6 mm, a surgical procedure may be the only way to gain full access for thorough cleaning and to promote proper healing. Systemic disease influence. Patients with systemic health conditions, such as uncontrolled diabetes, may have a compromised healing response. In these situations, a more aggressive or surgical approach may be necessary to effectively stabilize the disease. The decision to proceed with a non-invasive or surgical treatment plan is based on a comprehensive diagnosis by your dental professional, including a full periodontal exam and X-rays. The role of professional-grade at-home products. The term professional-grade at-home refers to products that are more potent, have a higher concentration of active ingredients, or utilize a specialized delivery system compared to standard items you might find on a pharmacy shelf. These products are typically recommended or dispensed by a dentist as part of a supervised treatment plan, bridging the gap between in-office procedures and a patient's daily oral hygiene routine. Tray-based delivery systems. How they work. These systems use customized, form-fitting trays to deliver a therapeutic antimicrobial gel, often a low-concentration hydrogen peroxide, directly into the periodontal pockets. The trays create a seal, holding the gel in place to disrupt the bacterial biofilm more effectively than a simple rinse. 2. Effectiveness. When used as a supplement to professional care, this method is highly effective at reducing inflammation, bleeding, and pocket depths. Examples. PerioProtect is a well-known brand that offers this type of customized tray and gel system. The gel is also sold separately under the brand name PerioRestore. Specialized toothpastes and rinses. Stannous fluoride toothpaste. This dual-action ingredient provides both anti-cavity benefits and powerful antimicrobial properties. The tin component directly attacks the bacteria that cause gingivitis and periodontitis, while the fluoride strengthens the teeth. Examples: look for products with the ADA seal of acceptance, such as Crest Pro Health and some formulations of Colgate Total. High-concentration xylitol products. Xylitol, a natural sugar alcohol, inhibits the growth of harmful bacteria by starving them. Used in specialized rinses or lozenges, it helps manage gingivitis and promotes a healthier oral pH. Examples: brands like Epic Dental and Spry offer a range of xylitol-based products. Advanced oral irrigators, water flossers. How they work: these devices use a pressurized stream of water to flush out plaque and bacteria. They are an excellent tool to deliver antimicrobial rinses below the gum line, a critical area for controlling periodontitis. 3. Examples: brands like Waterpik and Philips Sonicare offer various models, including those with specialized tips for subgingival irrigation. The role of antimicrobial rinses in oral irrigators. A Waterpik's effectiveness can be enhanced by using it with a therapeutic rinse. The choice of rinse depends on the patient's needs and a dentist's recommendation. Prescription rinses. Potent solutions like chlorhexidine gluconate, e.g., Paradex, are often prescribed for a limited time after a deep cleaning due to their strong antiseptic properties. Over-the-counter rinses. For daily maintenance, milder solutions are recommended, such as those with essential oils, e.g., Listerine, or those containing cetylpyridinium chloride, CPC, e.g., Crest Pro Health Rinse. Low-concentration hydrogen peroxide solutions can also be used, but patients should always check their device's manual for compatibility. A note on dilution: standard mouthwash bottles don't provide dilution instructions for a Waterpik because they are designed to be used full strength for swishing. The official recommendation from Waterpik is a 1:1 ratio, equal parts mouthwash and warm water, for most OTC products. However, the most critical instructions, especially for prescription rinses, will come directly from your dental professional. Always flush your Waterpik with plain water after using any solution other than water to prevent damage to the device. Non-invasive treatments for bad breath. Since bad breath is often a symptom of underlying oral health issues, many of the treatments overlap with those for periodontitis. Enhanced oral hygiene practices. Tongue cleaning. A significant source of odor-causing bacteria resides on the tongue. Using a tongue scraper or a toothbrush to clean the tongue daily can dramatically reduce bad breath. 4. Brushing and flossing. Consistent and thorough brushing and flossing remove the food particles and plaque that feed odor-producing bacteria. Antimicrobial mouthwash. OTC mouthwashes containing antiseptic agents like cetylpyridinium chloride, CPC, e.g., Crest Pro Health Rinse, or essential oils, e.g., Listerine, can help kill bacteria and provide a temporary fresh feeling. For persistent issues, a dentist may recommend a stronger, prescription-strength mouthwash. Professional dental care. Regular dental checkups and professional cleanings are essential for removing plaque and tartar buildup that at-home care cannot address. Lifestyle and dietary modifications. Hydration. Staying well hydrated is vital, as a dry mouth can contribute to bad breath. Water helps wash away bacteria and food debris. Dietary choices. Limiting strong-smelling foods like garlic and onions, as well as sugary and acidic foods that can promote bacterial growth, can help. Tobacco cessation. Smoking and other tobacco products are a major cause of both bad breath and gum disease. Quitting is one of the most effective ways to improve both. Quick comparison: non-invasive versus traditional surgery. Feature: non-invasive, SRP plus laser. Osseous surgery. Invasiveness. Minimally invasive, no cutting or sutures. Surgical, involves cutting gums and reshaping bone. Pain level. Typically minimal to mild discomfort. Significant postoperative pain and swelling are common. Recovery time. Very fast, often 24 hours. Several weeks. Gum recession. Minimal to none. A common side effect, teeth may appear longer. Primary goal. Remove infection and promote natural reattachment. Remove infection and surgically reduce pocket depth. Effectiveness. Comparable to surgery for most patients. Highly effective, but with greater risk and discomfort. Summary: your path to lasting oral health. Non-invasive treatments like SRP and laser therapy are highly effective. For many, they offer a comfortable and quick recovering alternative to traditional surgery. Maintenance is the key to success. Without a diligent at-home routine and regular professional checkups, the disease is likely to return. Professional-grade at-home products are powerful tools that, when used as part of a treatment plan, can significantly improve your long-term oral health. Always consult your dentist. Only a qualified professional can diagnose your condition and recommend the best treatment and maintenance plan for you. References.